Do you sometimes feel a pounding heart, get thirsty for no reason, or notice swelling in your hands? These clues might point to a hidden hormone problem called Conn's syndrome, or primary aldosteronism. Imagine your kidneys are a faucet that controls salt and water. In this condition, the faucet is stuck wide open, letting too much salt stay in your body. This extra salt pulls water along, raising blood pressure, and making you feel the symptoms above. What makes the faucet stay open? Most often, a small tumor adenoma in one of the adrenal glands produces too much aldosterone, the hormone that tells the kidneys to keep sodium. Less often, both adrenal glands become overactive, hyperplasia, or a rare genetic mutation drives excess production. Think of it like a thermostat that's broken. It keeps heating the house even when it's already warm. How do you know it's happening? Common signs include stubborn high blood pressure that doesn't respond to usual pills, frequent headaches, a feeling of muscle weakness or cramps, excessive thirst and urination, and sometimes a salty taste in the mouth. Some people notice their blood pressure spikes after eating salty foods, like a car that revs higher when you add more fuel. How do doctors find out? First, they will measure aldosterone and renin levels in your blood. A high aldosterone to renin ratio is a red flag. If that looks abnormal, imaging, CT scan, checks for an adrenal tumor, and a confirmatory test called a saline infusion may be done. Treatment depends on the cause. If a tumor is present, surgeons can remove it, often curing the problem. If the glands are simply overactive, medicines called mineralocorticoid receptor antagonists, for example, spironolactone or eplerenone, block aldosterone's effect, helping lower blood pressure and reduce salt retention. Can you lower your risk? While you cannot change a tumor that already exists, you can keep your blood pressure in check and avoid worsening the condition by limiting salty foods, staying active, maintaining a healthy weight, and getting regular blood pressure checks. Think of it as keeping the faucet's handle from being turned on too high in the first place. What's new in the field? In the last few years, genetic testing has identified several rare mutations that cause primary aldosteronism, helping doctors choose the right treatment faster. Mini laser ablation, percutaneous adrenal ablation, is being studied as a less invasive alternative to surgery for small tumors. Additionally, newer mineralocorticoid blockers with fewer side effects are entering trials, offering hope for patients who can't tolerate older drugs.